Okay, so first of all, as the CME is regarding the child psychiatric disorders among school-going children, and till now, many speakers have discussed regarding psychological management and other aspects of child psychiatric disorders. We'll now discuss something about medical management of child psychiatric disorders. In this presentation, I have kept it a bit simple because last time the feedback was it became a bit technical, and as we know that many caregivers and parents have also non-medical persons have also joined this webinar, so I've kept it a bit simple and we'll discuss the other aspects also. So, as we all know that for any disorder, for be it physical disorder or psychological disorders, medicines are available. So, medication are effective part of treatment, overall treatment for several psychiatric disorders of child and adolescent. Psychiatrists who usually prescribe the medicine related to child psychiatric disorders should fully explain the reasons for recommending the medications, what are the benefits that the child will derive from this medication, and what are the possible risks or adverse effects or side effects that may happen to the child, and also other treatment alternative which are available should also be discussed. And it's very necessary to emphasize that in child psychiatric disorders, the medications are not the standalone therapy. It should not be used alone. Mainstay of the therapy in many child psychiatric disorders consist of non-pharmacological management, like therapy and other psychological interventions, and medicine form a significant but small part of the overall total management. So use of medications should be based on comprehensive evaluation and should be part of a comprehensive overall treatment plan. So the treatment in case of child psychiatric disorder, the treating team, it's a teamwork. It consists of psychiatrists, psychologists, pediatrician, occupational therapist, other rehabilitational professionals, speech therapists, other all combined as work as a team for proper evaluation and proper management of child psychiatric disorders. So before recommending any medication, the child and adolescent psychiatrist, he takes proper history to interview of the child if possible. School-going children usually do give quite a good history, and from history should be taken from parents, both the parents, any significant caregiver which is living with the children, and in some cases feedback is also taken from school teachers or other significant people in the life of the child. And evaluation also includes administrating any scales or questionnaires which are available for various disorders. Physical examination is very important. In if there's some organic or any medical condition is found, proper referral to pediatrician is needed. Psychological testing, as clinical psychologists do, it consists of IQ test and other psychological assessment. Very important assessments are done, and in many cases laboratory tests are also required to rule out any organic cause, any medical condition. So medicines, when prescribed appropriately, in adequate dose, adequate for adequate duration, and if they are taken as prescribed with proper compliance, they help in reducing and eliminating very troubling symptoms and improve the daily function of the child. Medicines which have beneficial effect, as we all know, any medicine, any pill we take, along with beneficial effect, it does have some side effect. It may be small side effect, but it do have some side effects. In some cases, rarely this may lead to serious side effects also, but we have to keep in mind all those side effects before taking those medication and giving these medicines to our young children. First of all, what are psychotropic medication? So this word psychotropic might be new to many of the audience. Psycho means mind. It comes from a Greek word, the soul, or that is mind, and tropic means having affinity. So those medicines which act on the mind, who have an affinity to act on the mind of the person, are known as psychotropic medications. So psychotropic medications are the substances which when taken into body act through various brain chemicals and brain receptors, and bring a change into thoughts, mood and behavior of that person. So as many people might know that all these medicines, modern evidence-based medicines, get approved after trial in general population. So we have become aware of all these processes since COVID-19, as we commonly hear in news media also that trial is going on for COVID vaccine. First of all, the trial was done in adult person, then later the trial was done in children. So similar process is adopted for all kind of medication. First of all, the trial are randomized control trials are done for adult population. Then after, when it's successful in adult population, gets approved in adult population, then the trial begins for adolescent population or children, and then if the evidence is found, then only it gets approved. So in recent years, the research, it's an active area of research. Research has been done to understand the benefits and risks of all these medicines. So while the researchers are trying to clarify how early treatment is going to affect the growing body, as we all know that we as adults, we our growth has stopped, but in children the growth is very rapid. So how these medicines affect the growth of the child? So this is an active area of research, and both as a child psychiatrist and mental health professionals and families, we should keep in mind the both benefits and risk of these medicines before prescribing. So each child has individual needs, and each child's individual needs has to be monitored and taken into consideration before starting these medicines. So when it is a good idea to start psychotropic medications in young children? We all come across many children who has some problems. Parents often come to us and tell कि ये बच्चा ये प्रॉब्लम, इसमें ये प्रॉब्लम आ रही है, ये बहुत शैतानी करता है, एक जगह नहीं बैठ पाता है, या पढ़ लिख नहीं पा रहा है, इसका ध्यान नहीं रहता है. They come to us with many problems. But do we start medicine on all of them? No. Rarely, hardly 10-20% we start medicines, and in other we have to first do a proper thorough evaluation. So when it is a good idea to start a medicine in a children? When the risk of when the benefits of that medicine outweighs the risk of that medicine. So suppose a child comes to us with some problem. Suppose the problem related to ADHD. Child is not able to sit in the class, in the home. It's running from here and there, jumping and getting injured. So when do we decide to start a medicine? When the risk associated with that disease, the ADHD, outweighs the risk associated with the medicines. So side effects of the medicine, we all know that it will have some side effects, लेकिन जब side effects की तुलना में जो फायदा है वो ज्यादा होगा, तब हम लोग को मेडिसिन स्टार्ट कर देना चाहिए. वो इस हिसाब से हम लोगों को we have to taken into consideration all these points before starting these medicines. तो some children need medicine to manage severe problem. ऐसे बच्चों में जिसमें बहुत डिफिकल्टी आ रही है, पेरेंट्स को साइकोलॉजिकल इंटरवेंशंस काम नहीं कर रहे हैं, पेरेंट्स बहुत डिफिकल्टी फेस कर रहे हैं, बच्चे को हार्म होने का चांस है, बच्चा यहाँ से वहाँ कूदता रहता है, इंज्योर होता रहता है, ऐसी कंडीशन में बहुत ज्यादा एग्रेसिव है, सेल्फ इंजुरी करता है, सेल्फ हार्म करता है. ऐसी कंडीशन में जहां पे हम लोग का जो रिस्क है एसोसिएटेड विद द डिसीज, इट आउटवेज द रिस्क एसोसिएटेड विद द साइड इफेक्ट ऑफ द मेडिसिन्स, एंड बेनिफिट्स आर मोर देन रिस्क, देन इन दिस कंडीशन इट्स वेरी अप्रोप्रिएट टू स्टार्ट मेडिसिन्स. इन एडिशन एज आई टोल्ड कि कई बार क्या होता है कि साइकोलॉजिकल थेरेपी चल रही है, स्पीच थेरेपी चल रही है, डिफरेंट टाइप्स ऑफ थेरेपीज आर गोइंग ऑन बट स्टिल नॉट getting improvement after many weeks. So in those cases, to augment the therapy, we need to combine it with medicines. So combination of medicines and psychotherapy is very useful in such kind of cases. So, what are the common conditions in which medicines are generally prescribed by child psychiatrists? Bedwetting, also known as enuresis, so जिसमें बच्चा जो है रात में बिस्तर गीला कर देता है. If it's very common condition in very young children, before 5 it's very common, but even after 5, even after toilet training for many years, if the child is still causing bedwetting, school जाने लगा है but still causes bedwetting, so in those children it's very good to start them on medicine along with the psychological therapies. In anxiety, like school refusal is there, phobias might be generalized phobias or might be specific phobias, social phobias, generalized anxiety or post-traumatic stress disorder. In these conditions, if it is causing significant distress to the child and it's hampering the child's growth and ability to study and properly attend the school, so in these conditions it's good to start medicines, एंटी एंग्जाइटी मेडिसिन. अटेंशन डेफिसिट हाइपर एक्टिविटी डिसऑर्डर, एडीएचडी सब लोगों ने सुना है. It consists of attention deficit is there, short attention span is there, hyperactivity is there, irritability is there, and impulsiveness is there, impulsive actions are there. So if the child is getting very easily upset and frustrated and often having problems in school, जनरली इन बच्चों का स्कूल में बहुत प्रॉब्लम होता है, डिसिप्लिनरी एक्शन होते हैं, झगड़े हो जाते हैं, एक जगह बैठ नहीं पाते, क्लास में कॉन्सेंट्रेट नहीं कर पाते. सो इन दिस चिल्ड्रन इट्स अप्रोप्रिएट टू स्टार्ट देम ऑन मेडिसिन रिलेटेड टू एडीएचडी. Obsessive compulsive disorder, OCD, सब लोगों ने नाम सुना है. It's quite common in school going children. It generally starts in adolescent age. So if they are having recurring obsessions, recurring intrusive thoughts are there, compulsive behavior, repetitive acts, compulsive behaviors are there. So if it is hampering the day-to-day life of the children, hampering with the study of the child, so it's appropriate to start them on OCD medicines. Frequently child come to us, school going, जो बच्चे स्कूल जाने वाले आते हैं, हम पढ़ाई नहीं कर पाते, कंसंट्रेट नहीं कर पाते, एक लाइन पढ़ते हैं तो कुछ और थॉट आने लगता है, ना चाहते हुए भी थॉट आते हैं, रोकने की कोशिश करते हैं, रोक नहीं पाते. सो इन दिस कंडीशंस इट्स appropriate to start them on medicines. डिप्रेशन सब लोग जानते हैं, लॉन्ग लास्टिंग सैडनेस, pervasive sadness is there, helplessness, hopelessness, worthlessness, guilt is there, inability to feel pleasure. Sometimes in school going children, sometimes we see suicidal thoughts also. So if it's hampering the day-to-day life, it hampering the day-to-day functioning, be it family life, play, खेलने में प्रॉब्लम आ रही है, खेलकूद से पूरी तरह अलग हो चुका है, स्कूल की पढ़ाई बिल्कुल नहीं कर पा रहा है, पेरेंट्स के साथ इंटरेक्शन खत्म हो गया है, सीवियर डिप्रेशन है. In these cases, it's very appropriate to start them on medicines along with psychological therapies. Eating disorders, we see these disorders quite rarely in our setup, but we do find such cases of anorexia nervosa. Anorexia nervosa जो लोग नहीं जानते, it's a kind of self starvation is there. Binge eating disorder एक होता है जिसमें कि there are cycles of binging, and then vomiting, so it's also known as bulimia nervosa. So in this condition it's medicines are needed. Bipolar disorders, bipolar affective disorder, also known as manic depressive psychosis. There are alternating period of manias, episodes related to mania and episodes related to depression. So in this disorder, these are severe mental disorders, bipolar disorders, schizophrenia, severe depression, psychotic depression. These are severe mental disorders, and improvement is rare without use of medicines. So the medicines are needed in almost all the patients having severe mental disorders. Common mental disorders जो थोड़ी एंजाइटी है, थोड़ा स्कूल फोबिया है, सोशल फोबिया है, without medicines they this child can improve. But in severe schizophrenia है, bipolar disorder, so medicines are necessary in these conditions along with psychological interventions. uh, Psychosis, as I told, is schizophrenia, be it irrational belief, paranoia, hallucinations हो रहे हैं, delusions हैं. In these conditions medicines are necessary. Autism, we all have heard of autism. Autism consists of deficits in language, intersocial interaction, social reciprocity, and all these interaction lead to all these impairment lead to deficit in interactions. So in autism generally there is no drug of choice for autism, but sometimes in children with severe autism they have many comorbid condition. It may be ADHD might be there, there might be severe irritability might be there, there might be sometimes a few psychotic symptoms might also be found. So in this condition child may be very aggressive. So in this condition, for treating these comorbid symptoms, medicines are needed. In severe aggression, it may be related to impulsivity, impulse control disorders, or it may be related to ADHD, or psychotic symptoms might also be there. So in such scenarios, in severe aggression where there may be damage to the child himself or herself, or damage to the house property, or damage to other person, there may be self-inflicting injuries might also be there, like head banging, cutting, say, chewing themselves, cutting themselves, in seen in severe mental retardation also. So in this condition it's very appropriate to start them on medicines. Sleep problems not improving with other sleep hygiene interventions also need medicines. So what are the points we need to take into consideration before starting any medicines? The child psychiatrist should discuss with the parents the results of the assessment. The assessment includes the clinical interview, the history taking done by the psychiatrist, and other assessment done through scales and questionnaires and structured pro forma, may be done by clinical psychologist or other mental health professional. So overall, a diagnostic formulation is made and that is discussed with the parents. It's not like that it's in case of child psychiatric disorder, it's not like in case of medical disorder. ऐसा नहीं है कि जैसे जैसे मेडिकल कंडीशंस में होता है, जैसे मलेरिया है, सो वी नो दैट क्लोरोक्विन इज अ मेडिसिन फॉर मलेरिया. फीवर आ गया है तो पैरासीटामोल देना है. बट चाइल्ड साइकियाट्रिक डिसऑर्डर्स में ऐसा नहीं होता. ऑटिज्म की कोई दवा नहीं है, तो जो ऑटिज्म है तो ये दवा देना है. इट्स नॉट वन टू वन रिलेशनशिप. इट्स नॉट सिंपल लाइक दैट. We have to take into consideration what are the target symptoms that we will be targeting before starting that medicines. So the any intervention, be it pharmacological intervention, that is medicines, or non-pharmacological intervention, that is any behavioral therapy or occupational, any kind of therapy, it needs to be targeted towards specific symptom. सो द टारगेट सिम्टम्स शुड बी डिस्कस. पहले से ही पेरेंट्स को बताना है कि हम लोग ये सिम्टम्स के लिए मेडिसिन स्टार्ट कर रहे हैं, या फिर ये सिम्टम्स के लिए थेरेपी स्टार्ट कर रहे हैं. बाकी चीजें जो है उसके लिए या तो अलग इंटरवेंशन होगा, या वो धीरे धीरे अपने आप इम्प्रूव होंगे. वी हैव टू डिक्लेयर दिस थिंग्स बिफोर हैंड ऑल्सो. रिस्क ऑफ द इलनेस इफ अनट्रीटेड शुड ऑल्सो बी डिस्कस. अगर हम ट्रीटमेंट नहीं करते हैं, अगर हम मेडिसिन नहीं देते हैं, तो क्या क्या हो सकता है, ये भी हम लोगों को जो है पेरेंट्स को बताना है. अगर हम मेडिसिन देते हैं तो क्या क्या साइड इफेक्ट्स आ सकते हैं, माइनर साइड इफेक्ट क्या आ सकते हैं, माइल्ड साइड इफेक्ट्स क्या आ सकते हैं, और सीवियर साइड इफेक्ट्स क्या आ सकते हैं. कब उनको रेड साइंस क्या है. रेड साइंस मतलब ये होता है कि रेड फ्लैग जिसको बोलते हैं कि ये चीजें अगर नजर आ रही तो तुरंत जो है आपको डॉक्टर को कांटेक्ट करना है. सो रेड फ्लैग्स क्या क्या है, वार्निंग साइंस क्या क्या है, ये अगर आपके बच्चे में नजर आते हैं तो आपको तुरंत डॉक्टर से कंसल्ट करना है. सो ये सारी ही चीजें जो है हमको मेडिसिन स्टार्ट करने के पहले डिस्कस करनी पड़ती है. any known risks, साइड इफेक्ट्स और एफडीए वार्निंग्स. एफडीए फूड एंड ड्रग एडमिनिस्ट्रेशन जो होता है, जो सारा एविडेंस का जो है ध्यान रखता है और मेडिसिन को अप्रूव करता है, वो सम दो these people sometimes issue some warning related to some specific medicines. So these warnings need to be told to the caregivers and parents. ये भी बता देना ठीक रहेगा कि whether we are what medicine we are giving is either ऑन लेवल और ऑफ लेवल. ये में एक फार्मेकोलॉजिकल टर्म है, ज़्यादा डिटेल में जाने की ज़रूरत नहीं. ऑन लेवल मतलब ये होता है कि जिस कंडीशन के लिए जो दवा अप्रूव्ड है एफडीए की तरफ से, और ऑफ लेवल का मतलब होता है कि उस कंडीशन के लिए वो दवा अप्रूव्ड नहीं है अभी तक, बट उसमें यूज़ की जाती है. सो अप्रूवल का प्रोसेस जैसे कि मैंने बताया कि इट्स ए लॉन्ग लेंथी प्रोसेस, इट टेक्स मेनी ईयर्स. सो फर्स्ट ऑफ ऑल मेनी आरसीटीज आर डन, एंड इफ देयर सफिशिएंट एविडेंस देन only the drug gets approved by the FDA. So जिनकी स्टडीज अभी ऑनगोइंग है, अभी चल रही है, नई ड्रग आई है, चल रही है, स्टडीज चल रही हैं, सो वो ऑफ लेवल हम लोग यूज कर सकते हैं, बिकॉज दोज आर नॉट फाइनल अप्रूवल नहीं मिला है, बट दोज आर अंडर इन्वेस्टिगेशन. सो ये सवाल सबके मन में आता है, पेरेंट्स के मन में हमेशा आता है कि डज द मेडिसिन अफेक्ट द यंग चिल्ड्रन डिफरेंटली देन ओल्डर एडल्ट्स. सो बच्चों में जो हम दवाई दे रहे हैं वो adults की तरह ही काम करती है, थोड़ी डिफरेंट. सो इट्स ऑब्वियस दैट द बॉडीज ऑफ यंग चिल्ड्रन आर डिफरेंट, दे हैंडल द मेडिकेशंस डिफरेंटली. सो देयर आर मेनी डिफरेंसेस बिटवीन adults and young children. So young children are not mini adults. ठीक है. सो जो छोटे बच्चे हैं वो छोटे अडल्ट्स नहीं है. देयर बॉडीज आर डिफरेंट, देयर मेटाबॉलिक प्रोसेसेस आर डिफरेंट, देयर बॉडी प्रोसेस द मेडिसिन्स डिफरेंटली. वी कॉल दैट pharmacodynamic and pharmacokinetic interactions are different in case of children. So all these things are taken into consideration before starting any medicines. Also, brain of children are growing rapidly. As I told previously also, there's rapid growth in both brain, mind and body of the children. So we have to take into consideration all these factors before starting any medicine. Developmental differences are there, how the children metabolize the drugs is also different. The growing brain is very sensitive to side effects of these medicines. So these are important points, but we have to keep in mind that untreated mental illness, untreated mental disorders themselves can harm brain development. Okay, so like seizure disorder is there, epilepsy is there. Anti-epileptic medicines have many side effects, we all know, but if we don't give anti-epileptic medicine और बच्चे को सीजर आता जा रहा है, झटके आते जा रहे हैं, that itself can lead to brain damage, and that seizures, that fits can itself lead to retardation in growth, both mental and physical. Lastly we'll discuss some common medicines which are used. This is technical part, we will just take it superficially. ADHD medicines, stimulant medicines are available, non-stimulant medicines are available for ADHD. They come in different forms. Few examples name which we can remember because we are working in mental health field, like the methylphenidate we frequently use. Non-stimulant medicines which are used in older children are atomoxetine, clonidine. Antidepressant medicines are helpful in both depression and anxiety disorders also, school phobia, panic attacks, other anxiety disorders, even in bedwetting, eating disorder, OCD, PTSD, and sometimes in other disorders like ADHD. Antidepressant medicines are quite useful. इनके अलग अलग नाम कैटेगरीज होती हैं. SSRI होता है, SNRI होता है. SSRI में फ्लुओक्सिटिन, सर्ट्राइलिन, पैरोक्सिटिन. SNRI में venlafaxine, duloxetine. Other new drugs are also available like bupropion, mirtazapine. And the older drugs are known as older antidepressant drugs जो पहले आए थे. These are known as tricyclic antidepressants. These are also used in some conditions, like imipramine is used in enuresis, and clomipramine is quite useful in OCD. So these are the antidepressant medicines. Antipsychotic medicines are used in psychotic conditions related to psychosis, जहाँ पे delusions, hallucination, disorganized thinking और behavior रहता है. Antipsychotic medicines are also quite helpful in treating irritability, which is associated with autism, and aggression, which is associated with ADHD. टिक्स में भी यूज होता है. टिक्स आप लोगों ने सुना होगा, एक टूरेट सिंड्रोम होता है, इसमें टिक्स आते हैं, रिपीटेड बॉडी मूवमेंट होता है या फिर कुछ वोकलाइजेशंस होते हैं जिसको हम टिक्स बोलते हैं. दीज आर क्वाइट यूजफुल इन टिक डिसऑर्डर ऑल्सो. फर्स्ट जनरेशन सेकंड जनरेशन में डिवाइड होते हैं. फर्स्ट जनरेशन पुरानी ड्रग्स हैं, इनके साइड इफेक्ट ज्यादा हैं. सेकंड जनरेशन नई ड्रग्स हैं, इनके भी साइड इफेक्ट्स हैं बट फर्स्ट जनरेशन से थोड़े कम है. क्लोरप्रोमाजिन है, हेलोपेरिडोल है, जनरली यूज होता है. सेकंड जनरेशन में ओलानजेपिन, क्लोजापिन, रिस्पिरिडोन ये जनरली यूज किए जाते हैं. Mood stabilizers and anticonvulsant medicines, these are useful in bipolar disorders. Anticonvulsant medicines are also used in as an anti-epileptic medicines in epilepsy. These are lithium. Lithium is for bipolar disorder only, but anticonvulsants like valproic acid, carbamazepine, oxcarbazepine, these are used in both bipolar disorder and epilepsy also. Anti-anxiety medicines are same as antidepressants. Sometimes in anti-anxiety we use some augmenting drugs like benzodiazepines, sleeping pill जिसको बोलते हैं, alprazolam, lorazepam, diazepam, clonazepam. These drugs are also used sometimes for treating anxiety. Sleep medicines as all I have already discussed. Zolpidem वगैरह कुछ नई drugs हैं जिनका abuse potential थोड़ा कम होता है. So before giving any medicines, many questions arise in the minds of parents. So we need to properly answer those questions and satisfy their queries. We need to tell what are the names of this medicine. Sometimes what happens that from one medical store they purchase the medicine, the name is different, so they get confused, and for giving this medicine to children they are very sensitive. So we need to tell them कि ये brand name है, ये इसका generic name है. We should tell both the name, what effect it will have on their children, क्या क्या symptoms को target करिए, क्या क्या symptoms ठीक होगा, क्या क्या symptoms ठीक नहीं होगा. We have to tell beforehand only how the medicines work. एक short में बताना अच्छा रहता है कि इस तरह से दवाई काम करती है और कितने दिनों बाद काम करना चालू करेगी. आज दिया कल से स्टार्ट हो जाएगा. जनरली साइकेट्रिक मेडिसिन में ऐसा होता नहीं है. इट टेक्स 1 to 2 weeks at least to have any effect. What are the common side effects कौन से हैं और रेयर साइड इफेक्ट्स कौन से, सीरियस साइड इफेक्ट्स कौन से. तो डराना नहीं है कि मतलब ये भी हो सकता है वो भी हो सकता है, बट कॉमन साइड इफेक्ट्स क्या क्या हो सकते हैं एंड रेयर साइड इफेक्ट्स के बारे में जो है हम लोगों को सचेत रहना है, अटेंटिव रहना है कि ये जब अगर वार्निंग साइंस आने लग रहे हैं तो तुरंत डॉक्टर से कांटेक्ट करना है. It's a frequent misconception or myth that all psychiatric medicines are addictive. It's not like that. Few psychiatric medicines, especially the benzodiazepines, these are addictive. Other medicines are not addictive. रिकमेंड डोज एज आई टोल्ड इट, कब लेना है, कितना डोज में लेना है, डोज मिस हो गया तो क्या करना चाहिए, डोज एक्स्ट्रा ले लिया तो क्या करना चाहिए, क्या क्या टेस्ट करवाते रहने. सम मेडिसिन्स हैव साइड इफेक्ट, सो दोज पीपल ऑन दोज मेडिसिन्स नीड टू बी मॉनिटर्ड. रेगुलर ब्लड टेस्ट मंथली या 3 मंथली ब्लड टेस्ट होते हैं, उसका भी थोड़ा हम लोगों को पहले से बताना है और ध्यान रखना है. प्रोग्रेस, हाउ विल द प्रोग्रेस विल बी असेस्ड and who will assess the progress, what changes in the doses may be necessary. All these questions need to be answered. फ्रीक्वेंट क्वेश्चंस जो है हम लोग हमारे पेरेंट्स हमसे पूछते हैं कि ये दवा खा रहा है तो ये खा सकता है कि नहीं, खाने में ये खा सकता है कि नहीं, दही खा सकता है कि नहीं, रैंडम बहुत सारी चीजें, ये चीजें खा सकते हैं, वो चीजें खा सकते हैं कि नहीं खा सकते. सो ऑल दीज थिंग्स नीड टू बी आंसर्ड. व्हाट आर द प्रिकॉशंस which are need to be taken while taking medicines, and what are the foods or any other drugs which may have interaction with the medicine which need to be avoided or given at a different time. So this interaction and other things should also be discussed. Any activity that child should avoid and any recommended precautions. like sometimes if the child is taking any benzodiazepine sleeping pill for any condition or epilepsy, we need to inform the parent that the children cannot do the risky work, like खुद ड्राइव नहीं करना चाहिए, कुछ ऐसा काम नहीं करना चाहिए जिसमें रिस्क है, अगर स्लीपीनेस आ जाती है तो बॉडी को रिस्क हो सकता है. सो वी हैव टू अवॉइड this kind of activities. How long the children has to take this medicine, how to stop, कितने दिन खानी है, कैसे बंद करनी है, अचानक से बंद कर देनी है, धीरे धीरे, जैसे एंटी एपिलेप्टिक मेडिसिन होती हैं, अगर अचानक से हम बंद करते हैं तो इट प्रिसिपिटेट्स द सीजर्स, फिर से झटके आने लगते. सो हाउ वी हैव टू स्टॉप, ग्रेजुअली वी हैव टू स्टॉप, टेपर करना है आधा आधा करके, फिर धीरे धीरे बंद करना है कुछ वीक्स में. अगर कुछ प्रॉब्लम आती है तो क्या करना है ना. ऑल दिस issues need to be discussed. Okay, so these are my references. Thank you.